I researched the General Health Questionnaire, item 28, the short form, item 36, and the World Health Organization Quality of Life, the BREV version. The General Health Questionnaire, item 28, is meant to measure the current psychological state of the individual and the possible presence of a minor psychiatric disorder. The ICF domain is body function, and the measurement domain is the psychological and general health of the individual. This is a screening assessment that is self-reported by the individual. It is typically used with individuals 18 years or older, and it takes approximately 5 minutes to administer. The populations this assessment is used for are stroke patients and the geriatric population. Scoring and administration. The individual responds with one of the following regarding their mental status: better than usual, same as usual, worse than usual, much worse than usual. These are the options they choose from, and the first two responses are scored as a 0, and the last two responses are scored as a 1. The Likert scale of 0 to 3 has also been used, but is mainly used with the longer version of this measure. With the first scale, any score above a 4 indicates there is a possible issue. When using the Likert scale, a score of 23 or 24 indicates a possible issue. When administering this test, a pen and paper or laptop are necessary for the client to have if they are using a self-report. If it is an interview style, the clinician needs to be present, or the clinician should be present for any questions necessary. This is an example of some of the questions asked during the General Health Questionnaire. Biases. This assessment is not sensitive to individuals with chronic symptoms. Additionally, the results of the screening are sensitive to the scoring method used, such as the Likert scale or the traditional scale. This could also indicate a diagnosis, depending on the scale used. The depression subscale contains some questions that clients may not feel comfortable answering. However, although there are a few biases to this assessment, it is available in 38 languages, which means it's culturally sensitive. The psychometrics of the General Health Questionnaire, item 28, focuses on the stroke population. This slide contains psychometrics that are found for the stroke population. The intra-rater, inter-rater, and test-retest reliability of the stroke population with the General Health Questionnaire are all excellent. Psychometrics were also found for this measure using the geriatric population and the nonspecific
ischemic
heart disease. The inter-rater and intra-rater reliability for both of these have been found to be excellent. Additionally, for the nonspecific
ischemic
heart disease, the internal consistency was found to be excellent. Overall, the General Health Questionnaire, item 28, has good content validity due to it being a smaller version of the original 60-item General Health Questionnaire. A sample of 523 individuals who attended a primary care setting were involved in a study which resulted in 28 items from the original becoming a 28-item version. A score of 4 or higher on the GHQ 28 correlated with the presence of depression, which shows its predictive validity. The concurrent validity is excellent with the Zung Self-Rating Depression Scale, the Hamilton Depression Scale, and the Present State Examination. The construct validity has correlations with the SAQOL item 39 subtests. These were adequate to excellent. I'm going to be your occupational therapist for today. So we want to know how your health has been in general over the last few weeks. So I'm going to ask you a series of questions, and your responses are right in front of you, so I'll let you know which ones you'll be choosing from for the question. All right? Okay, so have you recently been able to concentrate on what you're doing? And use the first part of these responses.
Same as usual.
Same as usual? Okay. All right. Have you lost much sleep over worry? And you'll be using the second one for this.
Rather more than usual.
Okay. Have you felt that you are playing a useful part in things? And that will be the bottom one.
Same as usual.
Okay. Have you felt capable of making decisions about things? And you will be using the bottom one.
Same as usual.
Okay. Have you felt constantly under strain? And this will start with the not at all one.
Rather more than usual.
Okay. Have you felt that you couldn't overcome your difficulties? And you'll be using the same responses.
That I couldn't overcome them?
Mm-hmm.
Not at all.
Not at all? Okay. So, have you been able to enjoy your normal day-to-day activities? And for this one, you'll be using the more so than usual option. So, the bottom one.
Could you repeat that?
Yeah. So, have you been able to enjoy your normal day-to-day activities?
Same as usual.
Same as usual. All right. And then the last one for today is, have you been able to face up to your problems? And you'll also be using the same responses, the more so than usual category.
Same as usual.
Same as usual? Okay. All right. Thank you. The SF item 36, or short form, version 2, is meant to measure a health-related quality of life. It is generic because it can be used with any age after 18 with multiple diagnoses and treatment groups. The ICF domain is body functions and participation. Measurement domains look at the mental and physical components of quality of life. This can be used as a self-report or an interview, but typically there is little to no intervention from the interviewer. However, the interviewer should be trained in basic interviewing skills and in the use of this instrument. This can be used with individuals who are 18 years or older, and it takes approximately 10 minutes to administer. Scoring and administration. The subscales of this assessment are physical functioning, role limitations due to physical and or emotional problems, bodily pain, general health perceptions, vitality, social functioning, and mental health. These include both physical and mental components. The higher the score the individual receives indicates the better state of health they are in. When administering this assessment, the client should have a paper and pen or a laptop when doing the self-report. Additionally, a clinician should be present if the individual needs to be interviewed and or has any questions regarding the assessment. Each statement on this assessment can have 3 to 6 possible responses. In the leftmost column, the item numbers are listed according to the way they will be interpreted. Depending on the way the client responded to the certain item, their score will be recorded to a value between 0 and 100. When these responses are translated to the 0 to 100 range, it represents the percentage of total possible score achieved. The next step of scoring is when the items in the same scale are averaged together to create the 8 scale scores. Table 2 lists the items averaged together to create each scale. Items that are left blank, so these are missing data, are not taken into account when calculating the scale scores. These are examples of questions used in the short form item 36 assessment. One of the major biases for this assessment that could also be considered an advantage is that it is not specific to one population or diagnosis. This assessment is available in multiple different languages and countries and can be filled out online or on paper. The psychometrics for this assessment are specific for the geriatric population and those who have a disability. The physical functioning subscale of this assessment correlates highly with the EDSS and the ambulation index. The internal consistency in the inter-rater, and test-retest reliability are all high. There was not much information found for the validity of this assessment. However, the Arab version has high construct and content validity. So today we'll be doing an assessment called the SF36, and it's also known as the 36-item health survey. So it's also going to be determining your quality of life dependent on your report. So I'm going to read out the questions to you, and then I'll also read out your possible responses, and I just need you to tell me which response you choose, okay? All right, so number 1, in general, would you say your health is excellent, very good, good, fair, or poor?
Good.
Good, okay. Compared to 1 year ago, how would you rate your health in general now? Much better now than 1 year ago, somewhat better now than 1 year ago, about the same, somewhat worse now than 1 year ago, or much worse now than 1 year ago?
About the same.
About the same? Okay. The following items are about activities you might do during a typical day. Does your health now limit you in these activities? If so, how much? So your options for these are yes, limited a lot, yes, limited a little bit, or no, not limited at all. Okay? So you have the 3 options. So number 1 is vigorous activities such as running, lifting heavy objects, and participating in strenuous sports.
Limited a little bit.
Okay. Moderate activities such as moving a table, pushing a vacuum cleaner, bowling, or playing golf.
Not at all.
Okay. Lifting or carrying groceries.
Not at all.
Not at all. Climbing several flights of stairs.
A little bit.
A little bit. Okay. Climbing 1 flight of stairs.
Not at all.
Walking more than a mile.
Not at all.
Not at all. Okay. Walking several blocks.
Not at all.
Walking 1 block.
Not at all.
Okay. Bathing or dressing yourself.
Not at all.
All right. And then bending, kneeling, or stooping.
Not at all.
Okay. So the last part they'll work on is during the past 4 weeks, have you had any of the following problems with your work or other regular daily activities as a result of your physical health? So cut down the amount of time you spent on work or other activities. And the options are yes or no.
No.
No? Okay. Accomplish less than you would like.
No.
No? Good. Okay. We're limited in the kind of work or other activities.
No.
No. And had difficulty performing the work or other activities. For example, it took extra effort.
No.
No? Okay. All right. Thank you. The World Health Organization Quality of Life BRAV edition is a measure that is used to assess an individual's quality of life within 26 items. The ICF domain is body function and participation. The measurement domains are physical health, psychological, social relationships, and environment. These are also listed on the top right, which give the facets incorporated within each domain. This assessment is self-administered or interview style. It is used with individuals who are 18 years or older, and it takes approximately 10 to 15 minutes to administer. Scoring. The higher score indicates better quality of life. This assessment uses a 5-point Likert scale to assess what intensity and frequency they experience each of these statements in the past 2 weeks. The available responses will vary, but for example, some of them may be how much, how completely, how often, how good, or how satisfied. On the right-hand corner, there is a chart that has the equations for computing the domain scores. This is a sample of the World Health Organization Quality of Life BREV edition assessment. No biases were found. However, the advantages for this assessment are that it is found easily online and that it is available in 19 languages. The psychometrics found for this assessment focus on individuals who have experienced a spinal cord injury. A minimal clinically important difference was not established for this population. However, the minimal detectable change was noted for each subscale of this assessment. The intra-rater reliability is high. The inter-rater reliability is moderate to high. There is a moderate to high correlation of this assessment with a satisfaction with well-being index. There is a low to high correlation with the impact of participation in an autonomy questionnaire. No normative data was found. So now we'll be doing the World Health Organization quality of life breath version. So it's also about the quality of life that you experience, and then think about your life in the past 4 weeks when you are answering these questions. So how would you rate your quality of life? Very poor, poor, neither poor nor good, good or very good.
Very good.
Very good. Okay, good. How satisfied are you with your health? Very dissatisfied, dissatisfied, neither satisfied nor dissatisfied, satisfied or very satisfied.
Satisfied.
Satisfied? Okay. So the following questions ask about how much you have experienced certain things in the last 4 weeks. So the options are not at all, a little, a moderate amount, very much, or an extreme amount.
Okay.
So to what extent do you feel that physical pain prevents you from doing what you need to do?
Not at all.
Not at all? Okay. How much do you need any medical treatment to function in your daily life?
Not at all.
Not at all. How much do you enjoy life?
Can you review the upper options?
Yes, so a moderate amount, very much, or an extreme amount.
How much do I enjoy my daily life?
How much, just your life in general, yeah.
Very much.
Very much. Okay. To what extent do you feel your life to be meaningful?
An extreme amount.
An extreme amount? Okay. All right, thank you. Here are my references. Thanks for watching.